Over the past 5 years, on average, more than 96,000 cases of sexually transmitted infection of different types are recorded at our health facility around the country every year. This is despite the fact that Namibia has made commendable progress in reducing HIV infections in different population groups and demographics. For example, according to Spectrum data, Namibia now stands at 94, 99, 92 on the UNAIDS 95-95 cascade. In fact, the country has set the ambitious target to reach 97, 97, 97 on the scale by 2028. The greatest incidence of sexually transmitted infections are linked to syphilis, gonorrhea, chlamydia, trichomoniasis, hepatitis B, herpes simplex virus, and human papilloma virus.
Well, there was a need to revise these guidelines for a number of reasons, and I'll just mention a few of them. The last update of the STI guidelines was done in 2008 and 2009. And since then, you can imagine that the landscape of sexually transmitted infection management has evolved significantly with emerging scientific evidence. In the past 5 years, Namibia has also reported an increase in the trend of sexually transmitted infections, notably urethral discharge syndrome. And this is a public health challenge because sexually transmitted infections not only cause reproductive and psychological health impact, but they have also been noted to facilitate the acquisition of HIV. In addition, there was a need to align the management of STIs to the latest available evidence. The revision of this guideline was informed by latest guidance from the WHO, World Health Organization, CDC guidelines, and we also used laboratory data on etiology and resistance from NIP and PathCare. The team also diligently checked and compared recommendations from neighboring countries such as Zambia, Botswana, and South Africa, as resistance and etiological patterns tend to be similar across bordering countries.